Telehealth diagnosis for hip impingement can be extremely helpful, but the testing does matter. Today I'm going to show you 4 of my favorite tests that we use here at Performance Place. Make sure to stay tuned to the very last test because it's my favorite. We're doing Fadir's test, F-A-D-I-R, of the hip for hip impingement. And this is helpful to identify if there's hip impingement or even labral pathology, possibly osteoarthritis in the hip as well. Now I'm going to direct it as we do with our telehealth sessions because we can't actually be there with the person. Obviously in-person testing is always better. What we have them do is bring the hip to about 90 before we start making this passive because it is supposed to be a passive test. So we're bringing it into flexion, which is knee towards chest, abduction, which is across the body, and then we're going to take and start to move the shin or foot outward from that position. What we don't want is to start to move away from the original 2 positions, which is flexion, abduction, and internal rotation. At that point, if we duplicate the symptoms in the groin here, then we're more positive for something like hip impingement, labral pathology, and so on. But it's not the only test that tells us if it is or not. And some people have a false positive with this. So we need to make sure we test both sides and start to use other testing as well, such as other orthopedic tests like this or possible imaging to confirm the diagnosis. Scour's test for hip impingement or labral pathology. So what we usually do, just like our Fadir's test, is we bring them first actively, most of the time, into hip flexion, which can be painful, but when they rest here, it's actually most of the time okay. What we want is to bring them into flexion and abduction and start to make little baby circles as we're covering the acetabular rim all the way to the outside. We're looking for any spots of pain, catching, clunking, clicking, and so on. We can move it all the way out to the outer side, and you can use the other hand to also help support it too. Now there is some merit to actually taking it into a little bit of hip flexion and abduction and seeing if we can keep the internal rotation aspect of it, which is going to be foot facing outward. But for some people, that's not necessarily possible. And this test is actually hard for a lot of people to be self-directed too. So a lot of times we'll use Fadir's test to supplement the exam. Faber's test for hip impingement or labral pathology. So what I like to do is get the person to put their foot on their opposite knee and then see if they can use their hand to assist them to lower it down to where gravity naturally takes it and then we're hanging out. Normally when we're in person, we look to see if this type of stuff is happening, so you can obviously do it visually because you can see me do it now, right? But we want to see, without having this guy pop up, and you can have the person take their hand here and give you a little feedback on it, but how low can they get passively just to let it rest? And you can almost take a fist or measure like a fist distance, how many fists are actually there, and then compare to the other side here. What we want to see is they're generally equal. If it duplicates symptoms into the crease of the hip here, it's more positive for something like internal hip pathology such as hip impingement, but you oftentimes need other orthopedic testing and possible further imaging to confirm that diagnosis. In this video, we're covering a sign in the hip called Dremen sign, which is more an indication of some type of hard stopping point in the hip, such as a labral tear or even bony pathology, such as arthritis. So what we would do is we would have them bring their hip up into flexion, just as some of the other hip tests that we're doing, and we would see if it automatically auto-drifts out. What you can use as a questioning series later is, are you doing that on purpose or is it doing it on its own? And for most people, they'll say, I'm not doing it at all. This is just the way my hip goes. You'll see the knee kick out and you'll also see the foot start to spiral in. When you test the uninvolved side, it'll just go up and down like a piston most of the time. So this indicates possible hip internal pathology. It doesn't confirm a diagnosis either way, but it does give us insight into seeing what the internal structure of the hip looks like without doing an image. Wondering what else can be diagnosed via telehealth? Check out our other exam series that I have in the description below this video. And as always, if you want to work with us, please reach out.